Hi, everyone, and thank you for joining us this evening for the ninth week of the Rugby and Research Injury Prevention Group 2025 Journal Club. We will begin our first Journal Club presentation. Our first intern is Ritvik Panaganti from Georgia Institute of Technology. Ritvik will be presenting on investigating nutrition and hydration knowledge. Ritvik, may you please share your screen?
Thanks, Mana. Hello, everyone. My name is Ritvik Panaganti. I will be presenting on the research article investigating nutrition and hydration knowledge and practice in eighth grade rugby union players. This is a study that was published in the Nutrients Journal in 2024. So, a quick background, optimal nutrition and hydration are essential for adolescent athletes due to their high energy expenditure, growth demands, and training intensity. And this applies to any sport. And the rugby union has unique physical demands. This sport requires strength, speed, repeated collisions, and long match durations. So basically, a complete all-around athlete. And adolescents are especially vulnerable to low energy availability and relative energy deficiency in sport. And despite known importance that you need to eat well, you need to sleep well, you need to recover well, many youth athletes lack sufficient nutrition education. So, some rationale for why the study was conducted. Previous studies often looked at either knowledge or practice, rarely both. And no prior research examined both nutrition and hydration knowledge, in addition to actual behaviors in the nutrition and hydration in adolescent rugby players. And the Irish Rugby Football Union's Eat to Compete program, they provided education, but they lacked data on the effectiveness and the reach that they had. So some aims of the study include assessing nutrition and hydration knowledge using validated questionnaires and also collecting real-world dietary and hydration practice data, for example, like three-day food logs and the urine analysis. And in addition, they wanted to analyze whether higher knowledge correlates with better practices, meaning are the athletes retaining the information and also acting on it and utilizing this information. So the key question they're trying to explain are age grade rugby union players adequately fueled and hydrated for performance? And more importantly, are they applying what they know? So just a methods overview on the study. There were 28 male players, ages ranging from 16 to 17 years old, and they're from the Munster Rugby U18 school squad. And the duration of the study was a 2-week period during Munster's age grade development program in July 2023. So some of the instruments and measures that they used, like I mentioned earlier, the questionnaires. One of the questionnaires was the nutrition knowledge questionnaire, where it's a nutrition for sport knowledge, and another one was the hydration assessment questionnaire. And the in addition to the study, and for the dietary intake and what they were eating, there was a 3-day food record via the Libro app, and then also prior to hydration tests. There were pre-exercise hydration via urine specific gravity on 5 separate mornings. So this is a figure from the research paper. So as you can see, like at the beginning, you have the recruitment of the participants, and they had an inclusion exclusion criteria, and they had recruited 28 participants, and this is a neat breakdown of the two questionnaires. This is the nutrition one, this is the hydration one. And then this is what we talked about, like the hydration before, just checking what their hydration status was, like to see if they're how dehydrated they were, if they're well hydrated. And then this is breaking off into the 3-day food records for the dietary intake. And once again, there's an inclusion and exclusion criteria. And there's these are the 8 eligible records for the dietary intake. So as you can see, this is the total data that was available for analysis. So moving on to results, specifically about the nutrition knowledge. So the nutrition knowledge questionnaire had an average score of 49.6%, which falls under the poor knowledge category. And this is broken down into further broken down into subcategories. So most struggled with supplements, which their score was 36.3%, micronutrients, which were 44.6%, and sports nutrition, which was 46.7%. So once again, all in the poor knowledge category. However, they had better performance in the alcohol category with 59.4% and also in macronutrients with 55%. And here's some results regarding the hydration knowledge and also the practice of it. So the hydration questionnaire average score was 79%, which is in the excellent category, which is a significant increase from the nutrition one. And there's subcategories as well. So there's knowledge, attitude, behavior, 88% for knowledge, 79% for attitude, and 77% for behavior. However, when they analyzed the hydration before the like using the urine analysis but prior to the studies, on day one, 64% of the participants were dehydrated. On the second day, 82% were dehydrated. However, in days 3 and 5, only 14% were dehydrated, which is a sharp drop off to keep in mind as we move forward into like discussion and discussing why that happened. And here are the results regarding dietary intake. So 87.5% had energy deficits, and 0% of the participants met carbohydrate targets for the day. And protein intake exceeded needs, and it was unevenly spaced. And fat intake was mostly within target range, and fluid intake, 75% of them met the guidelines. So some limitation of the study is it's a small sample size with 28 people. It is not very big at all. And I mean they had exclusion criteria, so they had to like take some people out. And it was even more selective for the eligible dietary records where they only had 8 participants. And this is because of the underreporting in food records, which leads to it leads to limited dietary accuracy. So basically like if you entered food in a food log, some people might not do it super detailed. It wouldn't work for the study, so they had to exclude a lot of them. And there was no control group or like pre/post intervention, so you can't assess causality in this. And the questionnaires were also self-reported and digital. So like independent completion could not be verified. They could have had help from outside or they could have been doing it with someone else. And hydration behavior may have changed mid-study after the hydration questionnaire exposure. And lastly, data collected. It's also data collected during a single short-term development program. It's basically like 2 weeks, like we mentioned earlier. So this may not reflect players' habits across a full season. It depends, like maybe if you took it at the beginning of the season, people aren't really as focused and they're just coming back from off season, so all their levels might not be aligned. But if you're in the middle of the season, you might have better results because they're already in the practice program and they're in the middle of the season. So, just some discussion. No significant correlation was found between nutrition knowledge and reported intake. There was also no link between hydration knowledge and actual hydration status. So basically, when they took the questionnaire, maybe there were a good amount of people that were like, I know what good hydration protocols are, I know what to do. But when they checked the actual hydration levels, it did not match up with their knowledge at all. And the disconnect that was identified is they may have good knowledge because they've been taught it in school or their coaches preach it, but when it comes to like putting it into good practice, that just was not happening with a majority of the participants. And moving on, just discussion about the nutrition knowledge and practice. Players demonstrated poor understanding of key nutrition principles, especially carbohydrate needs. When we talk about these macronutrients, carbohydrates is where it lacked the most. So no participants met carbohydrate intake recommendations, and this is likely influenced by misconceptions that we hear all around us about carbs and body composition. Like for example, some people think too many carbs might be like leads to weight gain, and people think you only need carbs before and after exercise, but that's not true. Like you need it throughout the day to sustain energy. And also, the protein intake was excessive, which reflects popular trends rather than performance-based planning. So, I mean, these days that we hear, like just by any gym influencer, anything, everyone's talking about protein, like hitting your protein limits and things like that. And that leads to a lot of people prioritizing protein over carbs, and they think protein, they get energy from protein, but that's not true because carbs are the ones that give you energy. And like we said earlier, it's just too much protein intake. And also, the nutrition knowledge scores did not predict actual intake patterns the same way that we saw with the hydration. Many of these athletes did decent on these tests, but it did not predict their actual intake patterns. And all this suggests that players may recognize nutrition as important, but they lack specific knowledge or structure to apply it effectively. And lastly, moving on to discussion about hydration behavior and response. Players scored well on hydration knowledge, but they began the study dehydrated. So most arrived underhydrated on training days, despite reporting good habits on their questionnaires. And a big finding was that hydration improved mid-study, if you remember that drop off in the percentage was like 86 to 14% from day 2 to day 3. And this is likely due to awareness from urine analysis and questionnaire. So this is also called the learning effect. So they took the questionnaire and they reported to their urine analysis before. And when they got like a bad rating on the urine analysis, that led to them being like, okay, I need to like take care of my hydration more. I need to start drinking water more often, things like that, trying to influence their results. So there is no clear relationship between knowledge score and actual hydration status. And once again, this indicates that knowledge alone isn't enough. You need practical reminders and routines that may be more effective in shaping behavior. And these are my references. Thank you.
Thank you for that excellent presentation. Are there any questions, or Dr. Lopez, do you have anything you'd like to add?
No, I said it's always very challenging studying youth. You can get this out of share mode, Ritвik. It's always challenging when you're analyzing adolescents. It's difficult, but also the reliance on them reporting appropriately is a challenge. And we, like I said, I think they discussed in the paper, they didn't know if they actually completed the survey or maybe their parents, we don't know who filled out the survey. It's a difficult thing to do, but again, good study.
Okay. Our next intern will be Marianas Marquette from the University of Buffalo. Marianas will be presenting on nutritional knowledge. Marianas, may you please share your screen?
Are you able to see my screen? Sorry. Thank you so much for that presentation. Hello, everybody. My name is Inés Moquete, and today I'll be presenting research that explores the nutritional knowledge, attitudes, and behaviors in rugby leagues and how it is influenced by age, body composition, and ancestry for many rugby players. This study explores nutritional knowledge, attitudes, and behaviors in male rugby athletes from Australia. This study is important because nutrition is not just about eating right, but also is directly tied to athletic performance, injury recovery, and long-term health outcomes. This study looked at 50 players from a single rugby club during the preseason. Their average was 22. The average age for players was 22, and participants were grouped into three categories, which were under 20, 20 to 24, and over 25. This research also assessed body fat percentages, self-identified ancestry, to see how factors might influence players' eating habits and nutritional knowledge. Nutrition is essential for fueling the players when training, supporting muscle repair, and enhancing physical and mental resilience. But players don't all approach nutrition the same way. Their understanding and attitudes can be shaped by their culture, age, and even their access to nutritional guidance. For example, some players may not view food as tools for performance, while others might hold a strong cultural traditional, like around meals and food. While without good nutrition strategies, players may risk fatigue, poor recovery, and reduced performance, all of which can affect their careers. This study helps uncover those blind spots. The main purpose of this study was to assess three things: players' nutritional knowledge, their attitudes and towards nutrition roles in performance and mental health, and their actual dietary behaviors. Importantly, it also aims to examine how these factors were influenced by age, body composition, and their ancestral backgrounds, with ancestry broken into three major self-reported groups, which was Pacifica, Aboriginal, and Torres Strait Islanders, also known as ATSI and Anglo-Europeans. The goal was to identify the gaps that could help dietitians, coaches, and sports programs provide a better and more targeted nutritional education to players, especially those who are younger and have diverse backgrounds. The 50 The participants of the study completed a detailed 76 questionnaire online survey, and it was split into sections covering sports nutrition knowledge, their attitudes about the role of nutrition in areas like performance and mental health, and self-reported behaviors such as skipping meals or eating fast food. Participants also reported their background and their body fat composition, also known as DEXA scans, a highly accurate method of assessing lean mass, fat, and bone density. And for analysis, the researchers used statistical tools such as Pearson correlations to assess relationships between variables such as ANOVA tables to compare groups by mean, and ANCOVA to control the effects of age, body fat when examining the ancestry-based differences. With that said, the mindset, habits, and belief that these athletes were facing, the study found significant difference in nutrition knowledge behavior depending on the age of the athletes. For example, all the older athletes, especially those over 25, showed a more positive attitude towards nutrition and were most likely to eat like in line with their performances. Younger players, including those under 20, tended to score lower on nutritional knowledge and were most likely to skip meals. Also is shown in the table in correlations between athletes' age and protein intake, which is right here, as you guys can see. It shows that the older the players were, the more protein they had intake, while the younger players, they had less protein intake, showing that older athletes had a more greater nutrition knowledge and had greater guidance towards their meals. And also, this study explored that skipping meals is a major concern for athletes because it can lead to energy deficiency, slower recovery, and even muscle loss, which can cause results in more and worse degrees injuries. Younger players may not fully understand the role of consistent balanced meals in supporting their performances. This study found that cultural background played a significant role in shaping the nutritional behaviors. The group included the Pacific players, such as those in Polynesian, Micronesian, or Melanesian descent, and the ATSI athletes, which stand for Aboriginal Torres Straits Islanders, and Anglo-European players. For example, Pacific athletes were more likely to skip breakfast and lunch, which may reflect cultural meals patterns and social factors like living arrangements or financial access to food. ATSI, on the other hand, tended to place less importance on the connection between nutrition and mental health compared to Pacific players. The difference highlights the importance of cultural tailored nutrition and strategies. Now, to discuss, the study showed that across all participants, the average score of nutrition was only known to be at 39%, which is a poor rating. This suggests that even the professional levels, many players are not receiving every training in nutritional education. Pacifica athletes were more likely to engage in meal skipping behaviors, particularly skipping breakfast and lunch, which can impact their energy levels, muscle recovery, and performance during the sport. Meanwhile, ATSI athletes were less likely to view nutrition as a significant impact on mental health, possibly due to cultural differences in how health and well-being are understood. These findings suggest that interventions are need to be made that give players facts and education upon these factors so that they can be connected to their so that it can be connected to their identities, values, and living experience so that these issues can be fixed. The results that were found again were that the nutritional knowledge, like I said, was a score of about a 39 percentile. It was seen very specifically in the ATSI groups, indicating a low baseline knowledge for nutrition knowledge for athletes. There was also a small positive correlation between age and knowledge, meaning older athletes had a slight better understanding. No major attributes or differences were found between the ancestry groups, except in percentiles on mental health, with ATSI athletes scoring lower, and dietary behaviors vary depending on body fat percentage and ancestry, which reinforces that one size fits all strategies may not work well in the sport. To conclude, this study showed that athletes' nutrition knowledge is shaped by more than just education. It is shaped by age, body composition, and their background, which may influence how players eat, think about their food, and understand how they perform. There's a clear need for more cultural inclusivity in neutral programs in rugby that are sensitive to ancestral differences and also tailored to when athletes are in their development, such as the differences in age in many athletes. By improving nutritional knowledge and by making it relevant to their lives, experiences of those players can be improved, and teams can help athletes perform better, recover faster, and enjoy playing longer, having a healthy career in the sport and not suffering from major injuries that can prevent them or hold them from continuing doing what they love. Thank you. Here's my references.
Thank you for that excellent presentation. Are there any questions, or Dr. Lopez, do you have anything you'd like to add?
So there are no comments. Very nicely done, Medianis. Very detailed study looking at obviously ancestry, influences, everyone, coming from various backgrounds, even on this call right now, are with us. There are influences on how people eat, people drink at certain times. Europeans eat very late. Maybe Islanders eat earlier. Maybe people in the Mediterranean eat earlier. Like I said, it's very different, so it has an influence in that aspect. And I think they did a great job.
Our third intern is Alexander John Lewis from Syracuse University. Alexander will be presenting on rehabilitation and nutrition protocols. Alexander, may you please share your screen?
Thank you, Mena. Can everyone see my screen? Oh, sorry. Hold on. Everyone can see, right? My screen. All right.
Yes.
Hi. My name is Alex, and my presentation's on rehabilitation and nutritional protocols for optimizing return to play from traditional ACL reconstruction in elite rugby union players. This study was done in 2019. So a little bit of background information. We know that rugby is a very physically demanding sport, and in turn, we're going to need a lot of time for rehabilitation. So usually the rehab procedure would be surgical procedure, a short period of immobilization, and then the retraining program until the return to sport. The only problem with that is immobilization is directly associated with muscle atrophy or decrease in muscle mass and the weakening of the muscle. And that's not good for the player, and it's going to make him weaker going back into when he returns to play. So a well-planned nutrition exercise for rehabilitation was done on a soccer player recovering from an ACL injury. This player went through a low carbohydrate, high protein diet, including vitamin C, HMB, and creatine, and fish oil. There was atrophy observed, where there was 5.8 kilograms of whole body lean mass and 1.35 kilograms of immobilized leg lean mass. Following the 14 weeks, she saw an increase in lean body mass above baseline at 2.5 kilograms and immobilized lean mass at 1.2 kilograms above baseline or normal state. The only problem with that is she ended up above her normal state, but we want to decrease the amount of muscle loss that she did during the first 8 weeks after her surgery. So what they found was collagen-rich extracellular matrix of the muscle tendon plays an essential role in the function of the tissue. And the way that we produce the most collagen is through short bouts of mechanical loading and the availability of key nutrients such as proline and ascorbic acid. So basically, our aim is to adding to traditional best practice protocols for rehab following ACL tear and assess the effectiveness of nutritional regimen with high glycine, proline, and hydroxyproline peptides, along with low intensity exercise separated by 6 hours of rest, which could improve the repair of the ACL. So a little bit to know about the study. Both two rugby players, they're both international and representative male professionals. They both have 10 plus years of structured training programs under their belt. They played in full competition at the time of their ACL tear. The players were stable in weight, and player one did have a previous ACL tear in 12 months prior to his the one now, but he's made a full recovery since then. And player one was advised during his rehabilitation to lose upper body mass, so it might skew the numbers a little bit. So some interventions. So what they were designed to do for the experiment. There was a rehabilitation program started immediately after the surgery with the range of motion exercise and neuromuscular electric stimulation protocol. This was done 2 to 3 times a day with 6 hours of rest in between. Now, at the nutritional interventions, they consume 6 servings of high leucine protein greater than 0.3 grams of protein per kilogram of body mass per day. They also consume creatine monohydrate, loading 20 grams a day for 5 days after the surgery, and then after that, there was 3 grams a day. To look down here, this last bullet point, there was 10 grams of gelatin with 250 milligrams of vitamin C 30 minutes prior to the exercise. And that's where the collagen comes in order for the timing, because when you're about to work out, the collagen excess is very limited. So we're going to lift the collagen and get the synthesis up in order to remedy that. And this is just an image of the training period. So this is what they kind of went through. It's very detailed and yes. So as for the results, during the first 2 weeks, players saw a minor loss of body mass and in turn saw an increase in adiposity. So basically they just gained a little bit more weight and a little more fat. There was more change in body mass over the course of the week by player 1, which is when he lost 3.5 kilograms in comparison to the top player who lost 1.2 kilograms of body mass. Now this can be explained because the player was told to lose upper body mass in the upper region as part of the rehabilitation process. So that's why player 1's number is so much more higher than the other ones. Their whole body lean mass was reduced by 2.9 kilograms, which is negative 3.2%, and 2 kilograms, which is negative 2.3%, in players 1 and 2, respectively, at 17 weeks. At the end of their rehabilitation, player 1 had no difference between injured and non-injured leg. So small drops in lean mass and 0.8 kilograms in the left leg, which is 5%, and 0.6 kilograms, which is 4% of the right, when returning to normal state at 31 weeks. Player 2 saw a slight drop in lean mass at baseline, which is normal state, at 0.7 kilograms, as lean mass measures were stable over the rehab period. And a little bit more results. Both completed their range of motion. Both were out of their range of motion breaks after 6 weeks, and both achieved full range of motion at 19 weeks. And both players returned to maximum speed and acceleration at 27 weeks, which is what you want to see coming back from such a serious injury. Player 1 achieved maximum strength at 24 weeks, and player 2 achieved maximum strength at 15 weeks. Both were cleared to play rugby again at 34 weeks, but because of the scheduling and the scheduling of the sport of rugby, they can only play until about 42 weeks. So some discussion points to look at. Basically, we took the study from the soccer player in which he experienced a well-nutritional and exercise program, and we basically added gelatin and vitamin C in order to get the collagen excess that we need in order for the muscle to function. And we also used the exercise regimen of 6 hours in between so we can get the sprout muscle mechanical stimulus. Just some key things to look at. The body and skin fold assessments within the first 13 weeks showed minimal changes in the physique. So really their bodies didn't change at all. There wasn't really any change into their where their legs were. And player 2's whole body lean mass with losses were limited to 2 kilograms, with lean mass losses at 0.4 kilograms with injured leg, and no change to the non-injured leg. This is compared to the soccer player, where she lost 3.5 kilograms of lean body mass and 1.1 kilograms in the injured leg and 1.4 kilograms in the non-injured leg. Both players returned to maximal lower body strength prior to their return of lean mass to baseline levels, which is great because lower body strength is a key indicator into how a fast-paced rehabilitation is going. So this is a good sign for them. But we still saw signs of atrophy in the beginning, which is what we need to work on in the future. And this is just a graph of the reconstruction of what they did. So it's if you see the lines, they're very stable. So we didn't see too much change into their physique really. So that's a good sign. As far as our conclusion, there's definitely still more work to be done when it comes to the healing of the connective tissue. The associated attenuated loss of the function may support more rapid progression through return to play program. And the outline detailed, there was an outline detailed nutritional and exercise that was built upon its predecessor, which was the soccer player and her rehabilitation program. And we also translated in vitro work into effective return to play protocol. These are my references, and if there are any questions. Thank you.
Thank you for that excellent presentation. Are there any questions, or Dr. Lopez, do you have anything you'd like to add?
Yeah, just a quick question regarding, if I guess if the study mentions it, could you quickly outline as to how they allowed vitamin C and like you mentioned, like the other amino acids as the control for being, I guess, the reason why they were able to recover?
I believe it said they were taking, as far as the control I'm concerned, they were taking 10 grams of gelatin and 250 grams of vitamin C. They were both were taking the same amount. So they were both taking the same amount of intake in vitamin C and in gelatin, which contains the amino acids of proline and ascorbic acid. If
Yeah,
that
just
answers
asking
your
because
question, I
yeah,
hope.
it's just interesting. Yeah, it does. It just a little interesting with case studies because different people could process certain things a little differently than others, and of course that's why you have variations. Do you know after the study if I guess future studies kind of use the findings that they had from first the soccer and then second with this study if they're able to come up with a comprehensive like plan that includes vitamin C and the gelatin?
Well, as far as this is a very new rehabilitation program, so there's still work to be done. But this was just like a build off of what the soccer player went through. So there's still, but it was a good start because while we did see some more atrophy, there was less of it towards the end. And in the long run, they maintained their physical levels, if that answers the question.
Yeah, thank you.
All right, Alex, you want to come out of presentation mode? All right, all right. No, great job there presenting, presenting the topic. I think it was a ambitious topic to discuss the not only rehab, but then also a nutritional supplementation during the recovery. I think that's kind of the new direction. I guess that's why you saw those 224 papers just presented before yours, Alex. This is exactly the direction. That's why, we're right on top of it. Again, great presentation on the topic. Anyone else have a question?
That will conclude week 9 of the Rugby Research and Injury Prevention Group Journal Club. Thank you all for attending.